exactly what happened.
So I've been having this kind of like pain, this achy pain down the side of my thigh for the past couple weeks, but I've been really feeling it a lot more when I've been sprinting. It hurts a lot.
Okay, tell me about it.
So it's kind of like on the outer side of my thigh right here. It's kind of running up and down.
What could that be? Let me think back to anatomy. What was that thing that Professor Klein taught us about the side of the leg, that injury? Whoa.
Whoa, oh my gosh, where am I? Gwyn, it's Professor Klein.
Perfect. I need your help to diagnose Kelsey. She hurt her leg, the side of her leg, and I don't know what's wrong with it. I remember you talking about it in class, but I just can't remember.
It's the IT band, Gwyn. You can do this, but I've got to go. Bye.
Wait, don't leave. I need your help.
Help me, Gwen. The race is in a week and I need to be able to run.
Okay, give me a minute. You know what? I have the knowledge. I can do this. So can you. Let's help Kelsey. We can do this. Let's go over the bones of the legs. So, right here we have the femur, and then below it, articulating with it, is the tibia. And then right next to it on the lateral side is the fibula. And then right here, floating in between, we have the patella. Okay, so here we have the hip joint. So we have the femur that articulates with the pelvis. And so this makes up our hip joint, and we have three parts of the pelvis. So we've got the ilium, the pubis, and the ischium back here. And then we have our sacrum and our coccyx back there. Okay, can you point to like where your pain kind of is on this model?
It's kind of running up and down my thigh, like here.
Okay, it sounds like you might have a problem with your IT band or your iliotibial tract, but we just need to find out what's causing that problem.
Oh, IT band? I've done IT band stretches before, like this. Is this how you treat all your patients?
Wait, we don't want to stretch the IT band because it's just this really thick, dense tissue. But there are two muscles that insert onto the IT band, and we can stretch those. Let's take a look at them on the model. All right, let's talk about the muscles. But first, I need the magic probe. Perfect, let's get started. So our first muscle that we have is the gluteus maximus, and this inserts right onto the IT band, but most specifically, it's the upper fibers of the gluteus maximus. And then we have the TFL, or the tensor fascia latae, and that also inserts onto the IT band.
So you're telling me it's not really the IT band that's causing me the pain, but the two muscles that kind of make it up are pulling on it too tight?
That's exactly right. Let me show you over here. Here you can see the TFL, and when I pull it, you can really see this IT band gets really tight, like that. Same thing with the gluteus maximus. If I pull it, it really gets tight. All right, we need to stretch these muscles.
How do we do that?
Let me show you. All right, so normally when the TFL is contracting, it performs flexion and abduction or abduction of the leg. But to stretch it, we do the complete opposite. So we're gonna do extension and AD or adduction of the leg. You can really see how it gets stretched in this position. Now let's take a look at the muscle on Kelsey. So here we have the TFL. So when Kelsey performs flexion and abduction of the leg, you can see that the muscle scrunches up because it's being active. Now if we do extension and adduction, we're stretching that muscle. Do you kind of feel that stretch?
Yeah, I feel it a lot.
Okay, perfect. Now let's work on the glute max. Here we have the gluteus maximus, and so when this muscle is actively contracting, it's going to perform leg extension and external rotation. So to stretch it, we're going to do the exact opposite. So we're going to do leg flexion and leg internal rotation. Okay. So the best way to stretch this muscle is to do the pretzel stretch. So you're gonna kind of cross your legs over one another and pull it up close. Do you feel that stretch?
Mm-hmm.
Okay, good.
All right, I'm feeling better. Time to get back to training. Thanks, Gwen. I thought we were done.
Not yet. Can you guys at home think of anything else that could be causing IT band pain, specifically in runners and sprinters? So earlier when we analyzed your gait, we noticed this asymmetry. Can you guys at home think about what this might be? Okay, so normally when we're walking, we have a little bit of sway in the pelvis, but with contralateral hip drop, we have excessive tilting to one side versus normal. So here's sort of what's happening. So here's our pelvis in normal, and then this is what it looks like in contralateral hip drop.
Thanks for pointing that out, but why does it matter?
So here you can see the IT band is connected up here on the ilium. When we do contralateral hip drop, you can see how this IT band gets really tight.
Okay, how do I fix that now?
I'll show you. All right, so there's one muscle that needs to be really strong to counteract this contralateral hip drop, and that is the gluteus medius right here. So the gluteus medius performs hip abduction. So during contralateral hip drop, our hip is adducted. So when the leg is planted on the ground, hip abduction looks like the pelvis aligning itself back to be symmetrical. So the gluteus medius will pull our hip to be symmetrical. Whoa. We don't want to do that exercise. We don't want to bring our leg into flexion, because what muscle does flexion and abduction? That would be the TFL, but we don't want to work the TFL. We only want to work the gluteus medius. So we only want to be doing hip abduction. Okay, so we want to pull your hips forward and bring your legs back so we really straighten out, and then I want you to perform abduction until you hit my hand. Perfect. So we don't want to go into flexion because then the TFL will be taking over. Okay, so now we're going to work on some hip hike exercises. So this is going to work that gluteus medius, but you're standing this time. So I want you to stand on your right leg and your left hip is going to drop. And then I want you to bring your left hip up as high as you can, and you'll really feel that muscle working on the right side.
All right, thank you so much for your help. I gotta go train for my race. I'll see you later. Whoa, how did we get back to the clinic?
There's no time to explain. We have to finish with the adductors. So the adductors are a group of muscles on the medial thigh, and they perform adduction. So if these muscles are tight, they're going to pull the leg into adduction, which will tighten the IT band. Okay, so let's go through the adductor muscles. So in orange, we have the pectineus. In purple, we have the adductor longus. And then in yellow, we have the gracilis. And then back here, in pink, we have the adductor brevis. And all the way in the back, in blue, we have the adductor magnus. The posterior view, and you can really see the adductor magnus a lot better.
Okay, I've been feeling tightness in that area, but I've been doing one stretch for them.
Just one?
Yeah, just one. What do you mean?
No. We've got to do a few more stretches. There are so many muscles in this region, and so we've got to pick individual stretches to target each of these muscles. So let's start with the pectineus. So the pectineus does hip flexion and hip adduction. So to stretch it, we're going to do hip abduction and hip extension. So this next stretch is going to hit these three middle muscles, so the adductor brevis, adductor longus, and the gracilis. So to stretch these, we're simply just going to pull the leg into abduction or abduction. So the last stretch we're going to do is going to hit the adductor magnus. So the adductor magnus does hip extension and adduction. So to stretch it, we're going to do hip flexion and abduction.
Thanks so much for the help, Gwen. But you know, now it's time to crush you in the annual TA race.
Oh, it's on.
Woo!
It's on!
Take your mark.
Great job!
That's so good.
I always knew you could do it, Kelsey.
Me too. Thanks for watching.